Okay, let's start with choice. When conservatives or Joe Lieberman, party of one, talk about choice and Americans having choices, they're talking about Americans being free to choose or forced to choose the insurance that they can afford. The federal employees insurance is a menu of plans. It's not like Medicare where everyone gets the same treatment. It's a menu of plans that range from $5,000 to $12,000 or $13,000. Guess what? What's called postman's insurance, the $5,000 plan, not very good. A great many of the plans have very high deductibles. So as a middle-class person, you probably can't afford to use the insurance. It's simply the pretense of insuring everyone and saying, oh, and look, they have choices. They have this big menu.
You describe it, Luke, as, once we had a system that had private options, private insurance. Now we have a system that mandates private insurance, but there's no guarantee that anyone would be able to afford it.
That's right. Basically, what we see here are three separate programs. One is a fiscal program, one is a bureaucratic program, and one is a moral program. And interestingly, Joe Lieberman outlined it in just that way. The fiscal program is bending the cost curve. The bureaucratic program is insurance reform. And the moral program is getting people who can't afford health care now health care that they need. And what we're going to see, I think in the next month, what I wrote about in Harper's, Regulatory Capture predicts, is that we'll get insurance reform because insurance companies want this so-called reform. We'll get a little bit of moral reform because that's what a lot of people are calling for. But we're not going to get really any kind of cost reform because it's going to take a lot of money to bribe the insurance companies into giving us the moral reform.
Well, there are two things you have to take into account. First is straightforward regulatory capture. That is to say that this is a bill that is being written to assuage the people who are making the most noise. That is to say the doctors, the insurance companies, the providers. And that's pretty straightforward. We can see that Billy Tozan goes and he makes a request and it is honored. Billy Tozan being the head of pharma, the major lobbying firm for the pharmacological firms. But the other factor to keep in mind is a little more abstract, and that's that the people understand this system, this $2 trillion system, as something akin to a business. And we understand business as something that should grow. We see it as something that succeeds when more of it happens. But more health care is not what we want. Less health care is what we want because that means we're healthier. It's a really counterintuitive thing to get across, especially to an American voting audience.